I'm going to talk to you today about the differences between spinal fusion and artificial disc replacement. A fusion of the low back looks something like this. The clear acrylic are your vertebrae, the disc has been removed, then there's this implant inside that's titanium with screws, and it's locked, and it never moves again. This is a low back artificial disc replacement. This one is called M6. This is the artificial disc. These are the two vertebrae, but it moves. You see, you still have mobility and motion. So the spine can remain functional and active. In the neck, similarly, I'm showing you a full neck now. We see a plate with screws and a fusion. That is how a fusion looks. Now notice that that does not move. Only the discs above it move. And this is why you hear people have breakdown of adjacent levels, because of the stresses that occur when you do a fusion and this no longer moves. The other discs break down earlier. An artificial disc in the neck similarly looks like this, which allows motion and mobility.